Hi, my name's Jo Tantum and I'm a paediatric sleep consultant, and I've been working with little ones and their parents for over 30 years, helping them have more restful sleep and understanding their sleep better. Today I'm going to talk about teething. And teething, it can be a really upsetting and fractious time for both baby and yourselves. So we need to try and help them a little better. Now, most babies will start teething around 6 months old, some a little bit later. And what can happen is your baby will be more clingy, they'll be more grizzly, and they'll be wanting to bite and chew things, and they could probably be off their food as well. So try and give them their favourite food for a little while. And it usually lasts for around 72 hours until the tooth comes through. You can have lots of different medication for this. There's lots of teething gels, teething powders, and also teething liquids. And you can also give your baby some ibuprofen-based medicine. Now, ibuprofen works a lot better than paracetamol-based medicine because ibuprofen is muscle-based. And of course, when your tooth is pushing through your gum, it's coming through the muscle rather than a pain threshold. The pain threshold is quite a lot higher, so paracetamol might not work. The other thing that you might find is around 4 months old, your baby is going to start dribbling and putting everything into their mouth. And a lot of parents think that is teething. That is just actually a physical thing where your baby has started to understand about their hands. Their hands belong to them, and they just grasp the hand-eye coordination, and their gross motor skill becomes a lot more accurate, and so they will be putting lots of things in their mouth, and they will be dribbling a lot because they're putting lots of things in their mouth. The teething signs you need to look for are one red cheek, one hot red cheek, or two. Again, lots of putting hands in mouth, very grizzly and clingy, and you should be able to see the teeth coming through. So the bottom teeth usually come through, and the top teeth, and then they'll just keep going across like that, and you'll just see a little top poking through. You might even feel it might be a little bit sharp, so you know that the tooth is coming through. And like I said, once you can see the tooth, it takes about 72 hours for the tooth to push through. Try at this point, you can get some little things that you put on your finger to clean the tooth and the gums, and there's something great from Brush Baby that's like a little brush that they can hold on themselves. It's like their first brush, and they can put it in their mouth and really kind of chomp on it, and it's a really, really good idea. The reason that it does hurt baby is when the tooth pushes through, if the teeth aren't clean, the bacteria goes into the gum, and then that can irritate it and become really quite sore and inflamed. So that's a really good thing to do. The nappies will also get quite dirty nappies will get quite runny as well, and that's because the hormone is surging through baby trying to push this tooth through, and so just make sure that you're changing nappies quite frequently and putting some cream on them to help them keep them safe. There's lots of teething rings on the market. One of the best ideas I tell parents to do is have a damp flannel in the fridge, and they can hold onto the flannel and chomp on that because they seem to quite like that. Nights will be disturbed. But again, just try and soothe your baby, and also make sure that you are going through, so you give them the liquid or the teething gel, and of course lots more cuddles because they're going to be quite grizzly and fractious. So fingers crossed you get through to the other end, and unfortunately this lasts for a little while, but you will get into the rhythm of understanding what soothes your baby and what's best for your baby. So good luck and take care.